My name is Dr. Kate Burke, and I'm the Senior Medical Advisor here at Patients Like Me, and would like to talk to everyone today about chronic kidney disease. March is National Kidney Disease Month, and my message to everyone today is oftentimes people have no idea that they are developing chronic kidney disease. One of the myths is you may need to have pain or a change in your urination or some really obvious symptom that your kidneys are failing. That is the opposite from the truth. Oftentimes, people are silently developing chronic kidney disease. And that's why we are here today talking to you about the facts and what you can do. So, did you know 30 million American adults are estimated to have chronic kidney disease? And most people aren't aware the disease is present and progressing, just like I said. 1 in 3 Americans are at risk for developing chronic kidney disease. Risk factors, these are super important for kidney disease, include diabetes, high blood pressure or hypertension, heart disease, obesity, and a family history of kidney failure. People of African American, Hispanic, Native American, Asian, or Pacific Islander descent are at increased risk for developing the disease. Actually, Black people are 3 times more likely than whites, and Hispanics are 1.5 times more likely than non-Hispanics to develop end-stage renal disease or actual kidney failure. So everyone really wants to know about this disease so that you can share this information, share this video with your family and with your friends. So one of the most important steps you can take today is to understand what your risk factors are. So my suggestions for healthy kidneys include, if you have high blood pressure and have been prescribed medication by your healthcare provider, please take your medication every day as prescribed. If you have diabetes, keeping your blood sugar in range, eating a healthy diet, and taking medications as prescribed is also important. Also, if you have a family history or other risk factors for kidney disease, chronic kidney disease, eating a healthy diet is very important. Smoking, if you're a smoker, please quit. One more reason why we don't want to smoke is this is also a risk factor for chronic kidney disease. Also, if you're overweight or have obesity, you also are at risk for developing chronic kidney disease. So losing weight, working with your healthcare provider is also super smart. One last point is to avoid taking medications that may harm your kidney, such as something called a non-steroidal anti-inflammatory medication. And many of these drugs are sold over the counter. So you can just go in and buy them at a pharmacy without a prescription. Drugs such as ibuprofen, otherwise known as Advil, or naproxen, otherwise known as Aleve. Before starting those medications, please check with your primary care doctor or with your kidney specialist, just to be sure that this is something that you can take for whatever reason you need it. For example, if you have muscle pain or if you have arthritis pain. Over here at Patients Like Me, we recommend people track their health data so that you can track what's going on with your conditions so that you can in turn better understand what your progress is or where you may be hitting a plateau or a problem. And then you can bring this critical information back to your doctor to share with them so that they can give you the best possible advice about how to take better care of yourself. And one example is that of the tests we use for looking at whether or not somebody has chronic kidney disease. And these are tests in your urine and your blood. The urine test is called a urine CR or a UACR that measures if you happen to be spilling protein in your urine. And the other is your eGFR, which is a blood test that measures how well your kidneys are filtering. Both tests help your doctor, taken together, decide what type of kidney problem you may or may not have. So including these values in your tracking can be helpful to alert you to your health condition and things you may be required to follow more closely. And finally, I also wanted to mention that scientists and doctors are learning more every day through research and working with people like yourselves to find treatments to prevent, to slow down, and manage chronic kidney disease for everyone. So the takeaway is, please be sure to talk to your doctor and to see if you are at risk or if you even now have chronic kidney disease. Thanks so much for tuning in today. Take care now. Bye-bye.